Welcome to the Live Longer Better in Hertfordshire launch event. My name is Will Slemmings. I'm the Health Manager at the Heart Sports and Physical Activity Partnership. It's really great to be able to welcome not only so many people. I mean, we had nearly 200 registrations for today's event, which was really fantastic for a first event, but also the range of organisations that are represented here today has been really positive start to our movement. So thank you very much for being here today. A couple of event housekeeping points just to kick off with. So as you've probably already noticed, all participants are going to remain muted and off of camera throughout the event. However, we do welcome comments and networking through the chat function. I see there's already lots of bits and pieces coming through, so please do introduce yourselves on there. Feel free to share any contact details if you want to. The whole idea of everything that we're doing is we're trying to get more people working collaboratively, so please do use that function. We also do encourage questions to our speakers throughout the event, and you can do that through the Q&A function at the bottom of the screen. If you're doing that, please do indicate who your question is for. And then if there's time during the presentation slot, we'll address those questions live. And if not, we'll encourage the presenters to reply to those through a typed response through the Q&A function. Again, if there's not time for that, if it's one of the later speakers, we'll encourage them to get back to you independently. The webinar is being recorded and will be distributed to everyone that's been signed up throughout the event. And following the event, if you have any questions, please feel free to contact me. My email address is at the bottom of the screen there. It's also the same email address that's been sending all the links and everything to you over the last few days. So we've got a really busy event program lined up. There has been a slight amendment to the program that was circulated. As you can see early on, we're really thankful to welcome Anna Makepeace from Herts County Council and the NHS East and North Herts CCG to speak as well. We do have a 10-minute comfort and exercise break, I should say, scheduled for 11:15, and we'll do everything that we can to stick to that schedule. So, without any further delay, I'm delighted to pass you over to a man who we've got to know very well recently, knighted for his services to the NHS. So Muir Gray is going to introduce us to some of the theory behind Live Longer Better in Hertfordshire. I'm going to stop my share so he can do his.
Can you see that then, Will?
I can't at the moment.
Let's just try the wonderful share screen again. That might be it this time.
Yeah, that's getting there.
Okay. Let me just make... Well, ladies and gentlemen, welcome to this launch event, and Hertfordshire's taking the lead in this revolution nationally and internationally. And I'd like you to imagine that you were in a bowls club in Welwyn Garden City, or a bridge club in Hertford, or maybe the mosque, the Bishop Stopford's Mosque, or a church. Or, if you prefer, imagine you're one of your grandparents, or your mum and dad, if you don't have grandparents anymore. So I'm going to present to you the message, the new thinking about what happens to us as we live longer. And then I'm going to say a little bit about the context and what our plans are and how we see Hertfordshire playing a leading role with HSP in a key position, but also it's great. Age UK, NHS, local authority, and many other organisations are here. Okay, so ladies and gentlemen, thank you very much for asking me to come, and I'm coming to tell you the new facts of life. Not the birds and the bees, where babies come from, but the new facts of life about living longer. And there are only two phases in life, a phase of growth and development, a turning point, and then it's downhill all the way. But don't worry too much, because there's much that we can do about that. And it's not because of aging. Aging by itself is not a cause of major problems until the late 90s. and you need a bit of luck. But aging by itself, it has effects which we have to take into account. Aging reduces maximum level of ability, maximum heart rate, for example, and it reduces resilience, the ability to cope with a challenge like a change in temperature or a trip or lockdown. So the more we're affected by the aging process, the slower is recovery, and the recovery may not be complete. And lockdown is a particular challenge, of course. But ladies and gentlemen, the important thing to remember about aging is that it's only one of 4 processes. The 3 other processes are like this. The first is loss of fitness. And you can see here that from the turning point, which for many people is in the early 20s, not because of aging, but because they get their first sitting job and a car and a computer now, then a fitness gap opens up between the best possible rate of decline and the actual rate of decline. And of course, for many people, the turning point, as I said, is in the early 20s. And fitness has 2 features. One is the maximum level of ability, and the second is the ability to recover from a challenge. And you see, those are exactly the same as aging, which is the reason the medical profession has confused aging and loss of fitness for years. Now, this applies to the brain and the mind as well as the body. And I know that every doctor who was educated before the year 2000, people like me, we were taught that when you were born, all that happened to your brain was the brain cells died off from about the age of 20 on. That is completely wrong. We now know that brain cells can form new connections and even form new brain cells in what's called neuroplasticity. So that's loss of fitness. The good news is that whatever age you are, you can close the fitness gap. The 4 aspects of fitness, or I would say to you in the Bowls Club and the Bridge Club, there are 5 aspects of fitness, all beginning with the letter S. Strength, stamina, suppleness, and skill. And the 5th S is psychological. Yes, I'm very sorry for that, ladies and gentlemen, but exercise has immense psychological benefit and a direct impact on brain cells, as well as keeping the blood vessels of the brain healthy. The second thing that happens to us as we live longer is disease. Not because aging causes disease. You do need a bit of luck, like Her Majesty, to avoid diseases like Parkinson's or Alzheimer's that we can't prevent. But disease is caused by the modern environment. But what you can see here is the fitness gap gets wider faster after the onset of disease. And that's not because of the disease. There's no doubt that the optimal rate of decline accelerates if you have some condition that you develop. But as you can see here, the actual rate of decline goes down even faster. And this person drops below what I call the line. The line. And the line is the point at which you can't get to the toilet in time or can't tie your shoelaces. And that's it. Game over. Social care, please come forward. Healthcare needs increase. And the reason I'll come on to, but just to say the good news is that at any age, no matter how many long-term conditions you've got, you can close the fitness gap and keep above the line. So that's loss of fitness, disease, and the third factor is negative thinking or pessimism. So the son who sees his mum struggling to get to the shops, so immediately sends in delivery of groceries. Because, well, she's 82 after all, so we'll make things easier for her. Completely the wrong thing. Because the new facts of life are that the longer you live, the more activity you need. And that activity should be physical, cognitive, and emotional. And the more conditions you've got, the more activity you need. And I'll speak a little bit about what we're doing here. So, ladies and gentlemen, here is the new agenda. You have to understand aging. And you have to, every year, be more aware of loss of resilience. But we have to regain fitness and improve fitness, particularly after lockdown. And that's physical, cognitive, and emotional. We have to prevent and tackle disease. And we've got to think positive. So let me leave the Bridge Club or the Bowls Club, and speak to you now as key people in Hertfordshire. So how do we go about this? Well, I speak as a veteran of 27 reorganisations of the NHS. And this is not a matter of, it's too complex to deal with by structural reorganisation. And interestingly, the current reorganisation of the NHS, which I think is very, very important compared to the 26 others I've experienced, it's about a system. We need a system for living longer, better. And a system is a set of activities with a common aim. And the aim, as you can see here, is to not to increase life expectancy so much, but to increase healthy life expectancy or health span, and to compress that period at the end of life when you're very dependent on other people. That's what people want to avoid. And we now know we can reduce the risk of dementia and frailty and falls. And we'll hear from Anna later about that. We now know that we can increase health span and compress that period of morbidity. As well as a name, we need a set of objectives. And these will be circulated to you. And these are, we now have about 25 million of England signed up to these objectives. And you can see the second objective you may feel is particularly the Hertford Sports Partnership objective, but actually the work you're doing to increase physical activity, particularly physical activity in groups, helps many others of these objectives be achieved. For example, to reduce the risk of or delay, prevent dementia, to minimize the effects of deprivation. We do think particularly about poor people. Deprivation is still a major problem at all stages in life. To minimize the effects of disease. So almost all of these issues are tackled by increasing activity, particularly activity in groups. So how do we deliver this? Well, we deliver this through networks. The 20th century was the century of the bureaucracy. And bureaucracies are very important, essential in fact, for linear tasks like the fair and open employment of staff or the procurement of equipment. But when dealing with complexity, we need systems and networks. Private companies have a very important part to play too. The market has a part to play, but it cannot do these things by itself. And great work has been done already in Hertfordshire, led by the HSP. And this is, Will will speak a little bit later about the launch of the Network for Living Longer Better. So networks are sets of individuals and organizations who work together to achieve the objectives of the system. Now, the network is the leadership. It gives leadership. And leadership is about culture change. So we have to change the culture. And we'll do this by a number of ways that I'll talk about now. The development of a new language, stopping talking about care and more about enablement, a learning program, and digital. So let me just show you a couple of things. Here are all the things that are going on at the moment. And I'm just speaking mostly about nature and digital enablement, just to give you an idea of what's happening in different parts of the country. Let's take the Active Nature program. This has got a number of things: getting closer to green, getting older people with hands-on. Ramblers does wonderful work clearing footpaths, and engaging with wildlife. And increasingly, we're looking at ways in which groups of older people should be raising money for a good cause, like the Herts and Middlesex Wildlife Trust, and competing to do this. The older people of Welwyn Garden City competing against the older people of Hatfield. And this is a great service that's available in many parts of Hertfordshire. And I like them to complement this idea of a wild child with a wild elder. This is not official. This is just me mocking up their website to get older people involved in practical assistance and fundraising and creating jobs for young people. Secondly, we've got the digital enablement program, which is one of our main themes, and lots of good work going on in Hertfordshire. So So it's enabling people by using digital. And that means, of course, getting everyone online. And it won't happen immediately, but it's happening very, very quickly. And in many parts of the country, organizations are lending computers. The library service is very important. Age UK is very important. And of course, it also helps us network. So here's some examples of what we can do. This is a service that we're part of every general practice information system. And we're looking for volunteer practices in Hertfordshire. Wish. And this means that the GP and the practice nurse can send information to people, general information from, say, imagine if you had atrial fibrillation from the British Heart Foundation, but also local information. And this will happen automatically. And of course, we've got to get people online, but that's part of digital enablement. And this is necessary. Now, these are the words I get every year in my pillboxes, most of which, of course, I never read. But how many words did the NHS send me about the benefits of activity? No, this is not a mistake. This is how many words I got last year about activity. But here's what we're going to do. This is the launch of the Hertfordshire Activity Therapy Service. So this is what a prescription will look like, an activity prescription that'll be with every drug prescription. And this will be given out, and the practice nurse and the receptionist and the pharmacies will be involved in this. And I say, we'll be starting probably in May with 1 or 2 practices, but the GPs are up for this. And once COVID is passed, and remember, it's not passed forever, but the energy will be able to be used in different ways. So here's an example of what I might get if I had heart failure. I'd get a link to the British Heart Foundation, and there I'd meet other people with heart failure. I'll get an exercise program from a great little company set up by 2 physios who know that for every 1 person who sees a physiotherapist, there's another 5 who could benefit. I'll get a link to the Hartham Leisure Centre and a link to a walk near me in Willowmead. I'll just show 1 or 2 other things here. First, I don't like the word leisure. It's a well-being centre. And the key people are the trainers. And we're launching a new program for trainers about living longer better. Just as we're also launching a new learning program for about 1,000 people in Hertfordshire, including volunteers, about these new ideas. Because we need 1,000 people who'd be able to give that talk that I gave about the need for a new way of thinking. We've got to reach every church, every group, every bowls club. We've got to get discussions going everywhere. And that probably needs 1,000 people to go out and spread the word, to change the culture. And finally, I'd very much like to do a version of my walking book for Hertfordshire. But these are things that we can prescribe. This is the future. The future is here. It's just not evenly distributed. And I see great things happening in Hertfordshire, and I look forward to working with you in the years to come. And now I'd like to pass on to Anna to tell you more about the NHS contribution. Thank you, Will. Stop sharing.
Yeah, so hi everyone, I'll share my screen. So my name's Anna Makepeace. I'm here on behalf of Hertfordshire County Council and the NHS in Hertfordshire. I'm the integrated frailty manager. So I think I was just asked just to do a couple of slides in terms of the approach that we've undertaken over the last couple of years. I'm really keen to continue to work with us and kind of ensure that we are developing this. And I think everything that we've talked about before so far has really fitted in with the ethos. So just in terms of the NHS long-term plan, I know many of you on the call will already know this, but in the NHS long-term plan that was released about 18 months ago, a key part of that is about supporting people to age well. So following on from what Muir said, it is about actually people to live longer, not necessarily people to live longer, but equally live better. So there was a number of activities that were agreed in the long-term plan that the NHS is looking to roll out. So that's increased funding for supporting people in primary and community care. It's about bringing professionals together. So it really is about everyone working together as a system to support people to do this. We have we're part of the integrated care system. We have under the frailty workstream already a working group looking at frailty and falls, which brings together a number of these organisations. So you know, we're hoping some of the starting blocks are there. What we need to do is continue to build on that. We really want to help people to live more independently, so everything that we've already talked about, and also you know, improve the recognition of carers and giving them the support in order to be able to support people and to understand what they need to do. So just in terms of frailty, and I know all of you will know this, frailty is not an inevitable part of ageing. So the NHS see an older person living with frailty is actually a long-term condition. It's very similar to COPD or to asthma, so it should be treated as a long-term condition. But with timely intervention and prevention, proactive care and self-management, we can reduce the impact of frailty on that individual and ensure that that person is supported. And we need to make sure that person is supported in the community. So one of the key aims is to try and have wraparound support in the community, so not everybody's having to go to hospital all the time. And actually, if they are having to go to hospital, we're able to allow them to come home quickly and to be able to get that re-enablement support if required quickly. So just in terms of how we are trying to do this, so under the under health and social care, we have a frailty board which is set up in the integrated care system. So we do have a frailty board that's been established, has been running for around 3 years now. It is chaired by the managing director of East North Herts CCG, but includes people from the health, social care and voluntary sector. So that's really important. What we're trying to do is we're trying to develop really clear pathways. So basically, when somebody does have to get involved in the system, it's very clear where they need to go. So actually, we have a consistent approach across Hertfordshire that looks at best practice. So for example, if there's a really good practice in the north of England around identifying, we bring that into Hertfordshire and really trying to implement that as quickly as we can. We're looking to introduce a single point of access, so actually people don't need to keep saying the records, they don't have to keep telling their story twice, they can just say it once, and actually professionals can then share the information. So we've not got multiple systems, we have got that information in one place, and actually we can then navigate that frail person to the most appropriate service quickly and efficiently. We are looking together, and we have pulled together already a resource pack, so trying to pull together all the information that's needed around frailty, so both about prevention but also what happens, into a useful guide that can be shared with anybody really, with professionals, with carers, with people that perhaps are nearing their older age, just to give them a lot of information about self-management. The whole ethos is what we're trying to do is to try and support people to look after themselves. We're trying to have one care plan. So I don't know if any of you have looked after older people. I certainly have in Hertfordshire, and actually can feel that you're overwhelmed with care plans, overwhelmed with different organisations giving you different information, you're asking for the same stuff. Let's try and pull together one care plan, so you've got one story, and that care plan is about what that matters to that individual, you know, what is important to that person. It is around training as well, so actually we really want to upskill our staff across health and social care in order to identify people. We want to learn from others, so not just necessarily from health or social care, but what is happening nationally, what is happening in the voluntary sector. So really trying to bring everything together in order to kind of deliver the best in Hertfordshire, and that's why this partnership that we're here today and launching is so exciting. It'll give us that really great opportunity to look what happened nationally, but also to bring that into Hertfordshire. And I guess just from like a very practical side, we want to try and make it easier to collect the data. So actually, when we do want to find out about individuals or certain areas, we want to be able to get that consistent data collection, and then we understand what's happening in the area, and then we can implement things. So just really wanted to focus on falls really. So in terms of falls, you know, the whole ethos around falls is around prevention, identification, and then take action. So, you know, we really want to focus, and I know that's what we're here today to talk about, but really focusing on prevention. So as Muir said, frailty is not inevitable. You know, people having to fall is not an inevitable part of aging. What we want to do is try and support people that to actually be able to continue to be supported. And how do we do that? Through prevention, through exercise classes, through a range of different tools. If somebody is falling, we want to be able to set up a really clear way that we can identify that. So for example, using an assessment tool that is used across Hertfordshire, across all organisations, to be able to identify that, and then we can signpost them or give them the relevant support they need. So that might be classes, so it might be about signposting them to the correct classes. It might be about giving them that exercise prescription. It could be about actually having a fuller assessment to understand more what's happening, and that's about the taking action. So actually, when we do identify it, we are taking an action, and that person can be supported, and that person can be supported to kind of do the best they can. So these are just some of the things we're looking at the moment to deliver this. Now, COVID has been a particularly challenging time for the NHS and social care, as it has been for all of us. So part of what we need to do is to review where we are, look at the impacts, and actually start to work this through. But this is just where we are today. So we do have a falls group established across Hertfordshire and West Essex, which is our ICS. That group has got health, social care and voluntary sector, and that is looking about how we can support people that are and the falls agenda collectively together. Across Hertfordshire, so bringing it back to Hertfordshire, we do have falls vehicles. So through numbers, if people do fall, they can be picked up to prevent that hospital admission. So they have a full assessment, equipment can be given to them, and it's been running for a number of years and been very successful. So we have that service in place. Across Hertfordshire, we're introducing frailty clinics, which means that individuals will be able to get fuller assessments in order for us to be identifying and putting that prevention work earlier. We are promoting self-promotion, so all the discussion we've had around exercise prescriptions, trying to resource out, talk about all the resources, but also trying to signpost so it's very clear where people can get if they want advice and information. We've been working on that for the last year or so and trying to get that information out through all of our GP practices. And that leads me on to clear communication resources. So really trying to pull together everything so it's clear for individuals to really support them. We have an excellent programme that is delivered by the Care Providers Association in Hertfordshire, which focus on falls prevention in care homes and on with our care providers. So that's really supporting our people to live in care homes to think about how they can prevent. We have chair-based exercises. That service has been running for a number of years in Hertfordshire and has been really successful. We have agreed the assessment tool we want to identify falls through. So people that are at risk of falls, we have agreed that, and we have a code that can now go on your GP system. So now GPs will be able to complete that assessment tool and be able to on people's records so we can understand their falls risk and how we do this. And then finally, we are looking at how we share records across the system. So a key part of what we need to do is, this is about having that person first, and actually that should be at the heart of what we do. And so actually it is about how we share our records across the system. So I mentioned a single point of contact, but actually if somebody is having to deal with health or social care for any reasons, if they're at a point of crisis, they're not having to speak to 6 different people about their story. It is really about trying to bring it all together. So what I just wanted to end it on here was just kind of some of the work that we have done, and hopefully we can share this around later. What we have done is to try and support some of these conversations is that we have got some animation on the GP surgery screens. That's just an example here, but just about examples and ideas about what happens if you feel lightheaded, things about prevention, trying to prevent people around falls. So we've had that running for a number of years really, and they continue. A number of Ageing Well leaflets were produced for people at different stages of frailty, and they were sent out through GP practices and are available online. And we have a whole wealth of resources on our Healthier Future website, which you can be found here. I think that's it really. I'm happy to take questions, but really keen that we continue to work with you on this. I think it's a really exciting opportunity for Hertfordshire.
Fantastic, thank you very much, Anna. We have just had one question come in, which I think we could do, and we've got time to do now, which is from Rushna, and they have asked, what measures have you taken to take into consideration BAME communities' needs and cultural issues as part of the NHS long-term plans for patients?
So I think we probably need to come back on some of that work. So there is groups established looking at inequalities. So for all inequalities, for example, care homes and people carers, all the way through to the BAME community. I think probably we need to look at the work that we can do on that and continue to develop that. I'm conscious it's probably colleagues on the call from our social prescribing team who may be able to give more detail, and I noticed that Muir put his hand up, but I think we probably need to come back on that question if that's okay, Will.
Perfect, thank you. Muir, did you want to comment?
Yeah, this is where we see Hertfordshire making a contribution nationally. So we'd love to hear from any project going on. I did mention the Herts and Essex Mosque as an example. I've not been there, but that's an example of the type of community. So we'd love to hear from the person who asked the question, because I'm sure you're doing something that we can learn from. Thank you very much.
Absolutely, and I have seen a few bits and pieces from ethnically diverse focused organisations come up in the chat already, so that's really good to see, and please do keep them coming. Thank you very much, Muir and Anna. That was some really good insight coming in there, and we'll move swiftly on. So next, I believe we've got Jess from the Centre for Ageing Better. Jess, are you with us?
Yes, good morning.
Fantastic. Are you okay to share your screen and get going?
Yes. So good morning, everyone. I'm Jess Kuhne. I'm the Senior Program Manager for Healthy Aging at the Centre for Ageing Better. I'm just going to give a brief introduction on the Centre for Ageing Better in case you don't know who we are. So we started about 6 years ago now, when the former chair of our board, Lord Filkin, did an inquiry in the House of Lords into whether or not the UK is ready for an aging society, and found that the answer is no, we are not. And so on the back of that, decided to continue with working on issues related to our aging society, set up our organization. We are an independent charitable foundation. We are funded by an endowment from the National Lottery Community Fund, and we are a part of the network of What Works organizations. So this is a network of organizations. I think there's about 7 or 8, and then there's a couple of affiliate members as well, focusing on different areas. So I think policing is an area, education, early intervention, well-being, and we're all independent of government, and we all promote the better use of evidence in policy and practice. And we all work in slightly different ways, but we all share that mission to promote the better use of evidence. And the most well-known one that many of you probably will have heard of is NICE. So the National Institute for Clinical and Care Excellence is also at What Works Centre, and it is also the oldest one, so the one that most people are probably more familiar with. And our vision as an organization is a society where everyone can enjoy their later life. Also to note, as an organization, we've decided to specifically focus on individuals in mid to later life, which we are approximately defining as people in their 50s and 60s, so that 50 to 70 age group, because we know that what we do in that phase of approaching later life significantly impacts how we experience our later life. So we think there's still ample opportunity to affect the overall trajectory of our lives by focusing on this mid to later life stage. And here is a Venn diagram to show which of the issues that we focus on as an organization and kind of how they overlap. So we are focused on 4 main areas: work, housing, communities, and health. And I'm going to specifically talk about health today. So I'm going to give an overview of our State of Aging report. This is our flagship report that we try to come out with once a year. It launched at the end of 2020 and covers those 4 areas on work, housing, communities, and health. And I'm going to give an overview of the facts and stats that are covered on healthy aging. So on health, we know that people generally we're all living longer than our parents and our grandparents' generations, but we're not necessarily spending those additional life years in good health. And also progress on life expectancy has been stalling. So this slide shows that the proportion of people who are disability-free life expectancy at birth. So when we talk about disability-free life expectancy, what we're talking about here is health conditions or illnesses that limit your activity in any way. So when this question is asked, it's usually asked, do you have a long-standing illness or health condition or disability? And then if the answer is yes, the next question is, does this condition limit your activities in any way. And so that's really the concept. That's where we're looking at how we look at healthy aging. So it's not just having a health condition, but it's having a health condition that disables you in any way. And for women are spending about the last quarter of their lives living with a disabling health condition, and for men, it's about the last fifth. When you look at disability-free life expectancy at the age of 65, it's about the same for men and women. So men and women are spending roughly half the remainder of their lives at 65 in poor health. And that's what we're most concerned about, and that's what we as an organization want to address. Progress on life expectancy. So this slide shows that progress on life expectancy is stalling. So that is the purple line. So the left-hand side of the graph is disability life expectancy and disability-free life expectancy at birth. On the right-hand side, it's from age 65. And it shows that overall, while life expectancy has increased, it is starting to stall. But the big story here is that disability-free life expectancy, so the amount of time we can expect to remain in good health, is falling. And it's falling especially for women, and especially for women from the poorest backgrounds. And this next slide kind of shows again the same thing. So we are spending a longer proportion of our lives living with disabling health conditions. So this is just showing the proportion, the percentage of our lives that we're spending with a disability at birth and at age 65. And these figures are, of course, averages. So if you break this down by wealth quintile, you can see here that people living in the wealthiest areas have almost twice as many years of disability-free life expectancy ahead of them at age 65 compared to people living in the poorest areas. So really significant health inequalities. This also plays out geographically. So people living in the south of England have much longer disability-free life expectancy than people living in the north. And when you look at which conditions are the ones that are contributing the most to this burden of disability, this graph shows the years lost to disability for people aged 50 to 69, which are the purple bars, and for people aged 70 and over. And so these are not conditions that are necessarily causing death, but these are causing significant disability in our later lives. So musculoskeletal disorders, things like back pain, neck pain, joint pain, are easily the single most biggest contributors to disability in our later life. Mental health conditions are also quite a significant contributor. You can see also how it changes as we move from that 50 to 69 age group to 70 over. Sense organ diseases in the middle there take a big jump when we get to our later life years. So sense organ diseases like hearing loss and vision loss are a good example of conditions that don't really cause death, but are quite significant contributors to disability in our later life. And of course, these are once again averages. So once you look at how this breaks down by wealth quintile, the purple, this is a graph specifically showing how common some of these conditions are amongst women. So the purple dots are women from the most deprived areas, and the blue represent people from the wealthiest areas. So you can see that across all conditions, people from poor areas are much more likely to be experiencing these common health conditions once aged 50 and over compared to people from the wealthiest areas. And this is similar. So this next slide is for men. Similar themes for men, and this pattern plays out across all common disorders. So these next couple of slides are going to talk specifically about health behaviors in mid to later life. So this first one looks at levels of overweight and obesity, and men and women who have a weight that classifies them as overweight or obese, is highest actually in that midlife category. Similarly with alcohol, so again, people in that midlife age group are much more likely to be drinking at levels of drinking at harmful levels alcohol compared to younger age groups, which is an interesting story, because oftentimes the narrative that gets told in the media is concern about younger age groups binge drinking, which is of course a concern, but this occurrence of harmful levels of alcohol consumption in that mid to later life cohort doesn't really get that much attention. For smokers, smoking levels tend to fall with age, partly because people are quitting and partly because people are passing away due to smoking related illnesses. But even so, 1/5 of men aged 50 to 59 still smoke. So these are all quite significant health behaviors that put us all at greater risk of health conditions that cause disability in our mid to later years. So all these statistics and way more is available on our website. So we have a very interactive website that showcases all these facts and stats for health, work, communities, and housing. So I'd really encourage you to have a browse, have a look through that. This next section, I'm going to go more specifically into physical activity, but just more generally to get a sense of how we're aging, what the state of aging is for our country. Lots of really great facts and stats compiled in an interactive way on our website that I'd really encourage more people to have a look at. So I'm now just going to spend a bit of time looking more specifically at physical activity. So this graph shows that the older we get, the more likely we are to be inactive. I think most people are familiar with that. So the dark purple shows the proportion of people who are inactive, and by inactive we mean doing 30 minutes of physical activity or less per week. So as you can see here, physical activity levels start to drop at around the age of 50, and then they really decrease even more around people's 70s. And those, once again, are averages, so don't tell the full story. If you break this down by socioeconomic status, by wealth quintile, you can see that people from the poorest areas are more than twice as likely to be inactive as people from the wealthiest areas. There's a number of reasons for that. Less access to green space, different time constraints. It's something that we're actually looking into a bit more detail through our own research. Levels of physical activity also differ by ethnicity. So again, a variety of reasons for this, but white British and white other individuals are much less likely to be inactive than other ethnic minority groups. So once again, highlighting quite significant ethnic health inequalities here as well. And then probably no surprise here, but people who report living with a limiting disability are much more likely to be inactive than people who have a disability that they say doesn't limit them in any way or don't have a disabling health condition. And at the Center for Aging Better, we are doing some research looking into the motivations and barriers to physical activity in that 50 to 70 age cohort. So there's actually quite a significant amount of research and literature out there on what barriers and motivators are for older age groups, so oftentimes age 65 and over, but we're interested again in that mid to later life cohort. And these are some of the themes that are coming out of our research at the moment. So motivators include things like perceived health benefits, social connections, so having the opportunity for social activity that's combined with physical activity. Support from friends, family, and community can be a significant motivator. Particularly spousal support is something we found. Advice and support from health professionals plays an important role. Retirement, there's quite a lot of research on retirement as a transition point, which can act as a motivator. I mean, it can also go the other way, that people find that if they have less structure in their lives, that it might actually impede them from being more physically active, and perceived value of activities, so concessions for retired people as well. Some of the barriers that have been coming up in our research are probably of no surprise: pre-existing conditions, lack of time is a factor that's often cited, so due to work. So as a reminder, many people in their 50s and 60s are still working. They haven't retired yet. Many have caring responsibilities. Many people in this age cohort are in that sandwich age cohort, so may still have children at home that they are caring for, and at the same time may also be providing care for older family members. Lack of transport is often cited as a barrier. Also the cost or perceived value of equipment or memberships. So this is something that we're looking in. Why does this older age cohort not necessarily consider the offerings of the fitness and leisure sector to be of value or to be something that appeals to them? Age-related concerns such as having a fall or being too tired, or the belief that individuals in this cohort are too old to benefit from physical activity can be barriers. And finally, lack of culturally appropriate facilities in local areas, which includes tackling language barriers. So these are some of the key themes that are coming out of our research now. So the next step of our research is to dig into this a bit more as part of some primary research we're doing, and we hope that we can report more on this over the summer. So this research is due to be published at the end of the summer, and we'd be happy to share that with anyone who is interested. And then finally, just a brief point on how have physical activity levels actually changed during COVID. So this is data from Sport England's survey that they did just last month. So in March, individuals were asked how their levels of physical activity compare to this time last year, so pre-pandemic. And as you can see, people from younger age groups are much more likely to say they're doing more physical activity compared to this time last year, whereas people in the 55 and over age group are much more likely to say they're doing less physical activity than this time last year. And this is also a similar trend is playing out specifically when looking at reporting of strength. So again, younger individuals more likely to say their general strength has improved since the start of the COVID-19 outbreak, whereas for people aged 55 and over, it's the opposite. So they are much more likely to say their general strength has declined since the beginning of the pandemic. And this is having quite significant impact on people's physical health, on their deconditioning, on their overall muscle strength, on joint pain, on their ability to still do activities independently. And I think that is something that Mark is going to speak about a bit more about. Age UK has done some great research into the physical and mental impact of COVID-19 on the older age cohort. So that's it from me.
Fantastic. Thank you very much, Jess. Really insightful, and it's really nice to hear some of the national insights that are feeding into a lot of the work that partners that are that are watching the webinar now, it could be really useful for. So I don't think we've had any specific questions, unless any of my colleagues want to jump in to tell me anything that I've missed. No, in which case, if anyone does have any questions specific for Jess, then put them in the Q&A. Make sure you put Jess's name against it, and Jess can keep an eye on that as we go through the next presentation and can type an answer. I've seen that Anna's done the same. There's a couple of questions for Anna from her presentation, and she has, if you were one of those asking that question, she has typed her answers to those now. So thank you very much, Jess. Really, really useful stuff. And we're going to move on to our next speaker. And we're slightly ahead of schedule, which is nice. And Mark, are you there and ready to come in? Fantastic. Introducing Mark from Age UK Hertfordshire.
Thanks. Okay. I think this is working. You can see that.
Yep.
Good stuff. Okay. So yeah, hi. I'm Mark Hanna from Age UK Hertfordshire, and what I was going to go through is to talk to you about some of the research that Age UK has been part of, and what that found in terms of the impact of lockdown on older people has been. And then I was just going to summarise what the impact has been locally and what the local response has been as well. So, so we know that COVID-19 has disproportionately impacted on older people, and nearly 2 million people over the age of 50 had been advised to shield, as they had fallen within the clinically extremely vulnerable group, or the CEV group. But also everyone over the age of 70 were advised to take extra precautions, and particularly people who had long-term health conditions that placed them at a higher risk of transmission. So from this study that I'll go through in a sec, we found that a significant number of people say, as a result of the lockdown restrictions, that their normal kind of exercise routine had been affected, which meant that they were less able to take part in physical activity. In addition to that, a high proportion of people over the age of 50 and 70s reported that they had less access to non-COVID related healthcare, which we'll touch upon in a sec. And again, almost half of adults over 70 were reporting high levels of anxiety. So I'll go through the actual study results in more detail. So the methodology was that during August, there was a kind of an online survey promoted through the Age UK networks across the country. And it was very much looking at people over the age of 65, but particularly older. And around about the same time, there's also an online poll by Cantor Polling, which combined sampled about 2,000 respondents. A small proportion was with family carers on behalf of the people they look after, who, of course, were placed under more pressure to support their loved ones or cared fors. So from the results of this study, we saw that there was a good number of people who were in the shielding category, and a high proportion of people who had a long-term health condition. And there was also a high proportion of those who didn't have a long-term health condition but fell within that age category. So there was a good spread of people involved. As expected, I think a lot of this is kind of common knowledge, but from the study we showed that there were a number of health declines reported within these groups across the board. So with the study, we asked older people how much they agreed to a series of statements about their kind of reported decline, and a significant number of people said that they felt they had less energy, they were less steady on their feet, they couldn't walk as far as they could before, and some reported that they were experiencing a decline in their ability to remember things, which obviously is very concerning. And we gained a lot of feedback through the study and a lot of quotes. And with regards to this one here, it was from an older person who took part in the study about their physical health, just saying that they had this decline, and they had this kind of view that you either use it or lose it. And with their decreased opportunity to use it, they were fearful that they were losing their physical strength and resilience. So we've also found that as a result of the pandemic, it's exacerbated the health inequalities. So what we mean by this is that based on the responses from the study, we saw that people with pre-existing long-term health conditions before we went into the lockdown were more likely to say that they had less energy, were unsteady on their feet and felt less independent. And that then got worse. It was more likely that shielders had similar impacts, and a lot of that is probably expected. So if you had health conditions going into the lockdown, they became worse proportionally to those who didn't. And equally, we found that people who took part in the study who were from disadvantaged social backgrounds, they were more likely to report less energy, being less steady on their feet, and not being able to walk as much as those who were from a more advantaged social backgrounds. So that socio-economic factor came through in the study. So as a result of this physical deconditioning, we found from the results that generally the feedback was older people were finding it harder to walk and were more reliant on walking aids to assist them. Dealing with everyday household activities were becoming harder, and this had a kind of a knock-on effect on people's mood and their motivation, energy levels, which in turn had an effect on their weight. And the weight can work both ways. It can mean that we found that it meant that people were eating more as a result of compensatory factors to their anxiety, or it actually worked the other way and they were eating less. So we have a bit of a kind of a double-edged sword here with regards to the issues facing with increased weight and the health concerns there, and also the health concerns with the eating less and potential malnutrition there. And we see both of those things. And the people that we spoke with during this study were also reporting more frequent falls during this time as compared to pre-lockdown. So we can see that there's been a kind of steady decline in people's physical ability as a result of having less access and motivation to access it. So some of the feedback here I think is important to look at, because it kind of just contextualized the results from the study. As you can see, some of the comments there are that people are finding it less easy to access certain areas of their home. Balance is becoming an issue. And if you look at the middle quote there from a lady between the age of 85 and 89, that's obviously a key period of making sure that people have access to physical exercise and resilience, because that's one of the higher risk areas of not having it going down into that level that we talked about at the beginning. And equally, from the family side of things, it's quite important to see these things, because they can notice the decline perhaps more than the person themselves. And in this quote here, we're saying that the lady's mum used to catch buses to the next town and walk across town and back home on the bus, but now that she's struggling to walk down the path, which can show the impact of physical deconditioning that the lockdown has had. So what we found from the study and from what we know about the long-term impact of the reduced health was that there has been a reduced access to appointments and treatment, and that's no criticism of the NHS at all. It's just a fact that they've had to prioritise with the influx and increased demands that they have over this last year, which has been absolutely unprecedented. And in terms of the people that were waiting for treatment, we have found that a lot of those people, their condition has deteriorated, which would stand to reason in terms of that, and that's not specific to older people, of course. There are still many older people who we're supporting and were involved in the study, who have still got anxiety around when their treatment's coming. For instance, in some of the quotes that we see here, the middle one in particular, the lady's mum had arthritis. She had a hip replacement in the February pre-lockdown. She did have a post-op check in person, but there has been a kind of a steady drop-off of the follow-up in that situation, which meant that there's a view that the kind of circumstances have deteriorated more so than pre-COVID. And so we see that the impact is not just physical, but there is also a kind of a mental aspect in terms of anxiety about their prospects and their recovery. And in line with that, and again, it kind of stands to reason that this is the some of the results that we found was that people who needed help with daily living tasks, and this could be domestic tasks, it could be mobility tasks, using stairs, or transferring in and out of bed, or on and off the toilet, or washing themselves. If they needed assistance to do those things, or they had a degree of difficulty to carrying out those tasks pre-COVID, we found from the results of the study that they got worse in a probably a higher degree than they would have pre-COVID, based on the responses that we found. So again, with mental health, and I know physical health and mental health, they're so interlinked, it's difficult to separate them and look at them in isolation. But when we look at mental health, the impact of the not being able to go out and do the physical things had a direct impact on mental health. And with the older age group, that's we're seeing a kind of a higher proportion of that in terms of the impact. So this is a quote from the study which showed that this person who was young in terms of our kind of standards, that she felt scared to go out. That meant that she became more depressed and her pain got worse, and that was kind of a vicious circle where there was no kind of interaction with people, the financial situation, and the fact that, from a kind of a motivation to cook side of things, it was a more around kind of looking at getting takeaways, which then had a knock-on effect to her weight. So a very kind of vicious circle, which then meant that she had feelings of being undervalued and things like that. And with the increase in anxiety from the study, and in a sec I'll just talk about the local impact of what we saw, but it ties in. There was a massive increase in anxiety based on the results from the study, that people just felt more anxious. A lot of it was the uncertainty at the beginning, obviously, about how to access support and things like that. But from the study, it showed that people with long-term health conditions or had been shielding, the anxiety was a lot higher. And that goes in line with a lot of the other results, because it shows that just generally people were just more uncertain about the future, more worried about their health because they were at greater risk. And so that had a knock-on effect on their anxiety. And as you can see from some of the quotes here, there's somebody who just felt it was too risky to go out, and then had a bad experience when somebody coughed in their face, and that then meant that they were more anxious and then had to self-isolate. And people being more isolated through fear and anxiety. And the bottom quote from a lady who took part in the study between 70 and 74 years age, was scared of contact with people, but then at the same time was scared of being isolated. So, that anxiety about being stuck between a rock and a hard place was clearly evident. This then had an impact on loss of confidence generally. We asked the older people in the study how their confidence in doing common activities had changed since the start of the lockdown, and the results showed that a significant number of people felt less confident going for short walks, for their daily exercise. So as a result, they felt less confident about even leaving the house by themselves and going to the hospital appointment and the GP surgery. And a quote here just kind of shows that in context, that from a family point of view, or a carer point of view, they see that the lockdown has drained that person's confidence, and from somebody who was very social, going out daily, is now scared of going over the doorstep. So this is a real life example with many of these just from the study, but obviously that's wider, how the impact on the lack of physical exertion, the increased difficulties with their care needs or their daily living needs, impacts on their anxiety, their mental health, and then their confidence. And which then leads to low mood and lack of motivation. And from the study, we saw that over a third of older people agreed that they felt less motivated to do the things they used to do, and lost pleasure in doing things that they would normally find enjoyable, which had a real severe impact, because the people that were struggling anyway with daily living tasks like getting out of bed or washing themselves just didn't do it, or didn't do it as much. It took a lot for them to try to muster up the motivation to do so. And in the absence of that social contact and that meaningful social contact that they were having before, had a knock-on effect on their ability to manage their care needs. And some of the examples here from the quotes is that people were obviously feeling that it wasn't good in terms of outcomes and prospects, and that had an impact on their view on the future. There are people that you know, quote here in the middle from a lady between 65 and 69 years. So again, not old in our standards. I just sit here and I know I should get up every now and again due to other health reasons. I go days without showering, lost all energy to self-care. And locally, you know, we found in Hertfordshire that we were encountering more people at risk of self-neglect as a result. So just from a local impact, because that was done based on a national study and utilising the Age UK networks. But just from a local side of things, Age UK Hertfordshire, we saw during the first 3 months of the lockdown, between April and June 2020, we saw an absolute surge in inquiries, as did I'm sure all the other advice agencies like CAB and Herts Help in particular. But we saw a surge from older people contacting us, and the main issues were concerns around and anxieties around not being able to get a shopping appointment or telephone delivery slot for those who could access it, because we had a lot of people that couldn't. And we had to support them in a different way. Accessing outpatient care, a lot of cancellations of appointments, concerns around their health. Accessing befriending services, a lot of befriending services use volunteers. Our volunteers generally are over 70, independent 70-year-olds, many of which had to take extra precautions and some of which had to shield. So accessing the normal social support. GP appointments, divorce, separation, relationship breakdowns. We saw a surge in inquiries about familial issues between couples, older couples, that were exacerbated by the pressures of decreased contact with the outside world. Accessing ambulance and A&E support, concerns around how were they still running and whether they could access that. Needing a prescription to be collected for them was a huge thing across the whole board, not just us. Accessing money. We have a lot of people who cannot access their bank. They rely on support from family or other people to do that, and that was a huge issue for us. Obviously concerns around physical health problems. Bereavement was a big one. People who lost loved ones during lockdown were not given the usual level of support that they could pre-COVID, and that was a huge impact on their well-being and a huge concern for us and everybody else. Help with online deliveries, accessing care and support, and shopping, and feeling lonely. So again, you know, common issues across the board that I'm sure we're all aware of. But we received over half of what we would normally do in a year in terms of inquiries coming through to us at Age UK Hertfordshire, we did in the first 3 months of COVID. And I think a lot of the other advice agencies are the same. Just an absolute surge in influx of concerns. So, I mean, obviously what we've talked about so far, and don't worry, this is the last slide, but what we've talked about pre this is looking at how the impact has had an effect on people, and it's been severe. There's no getting around it. There's been a period of physical deconditioning, which has then had a knock-on effect on mental health and then low mood and motivation to do things. During this period, though, over the last year, but during the first 3 months particularly, the whole VCS, the voluntary and community sector, has done an amazing joint collaborative effort to meet the need, and we've really shown how resilient and robust we can be by working together and meeting the needs. And it's not just Age UK Hertfordshire by any stretch. There are other partners on this call, in fact, that have been absolutely instrumental in the response. But just from our findings and from our kind of perspective, we've had to respond very quickly with our partners, and we've had to coordinate the response from our point of view with our volunteers. We're lucky enough to have quite a number of volunteers, and it was around distributing food parcels and shopping trips for those people who needed that support, who were over 70, who were isolating or who were shielding or what have you. The people that needed the help, that was the response we gave. And prescriptions delivered, and we saw a huge increase in anxiety and people reporting mental health issues in Hertfordshire, and that tapped into the emotional support services that we provide. And we try to minimise the impact of the physical deconditioning that we were aware of through delivery of activity packs and online groups and activities. With the food packs and prescriptions, the Hospital and Community Navigation Service, which is a huge social prescribing service, was absolutely fundamental in getting those packs out and getting people supported. And the 1,500 emergency food parcels and shopping and the 500 prescriptions, they were just what we did. HCNS, Hospital and Community Navigation Service, did a hell of a lot more. But in terms of the activities and getting online groups, again, the partnership for Herts-wise, we were able to deliver over 5,000 online attendances for activity groups, and our lunch clubs and day centres were able to do this to get people online. And we're also able to help people who were digitally excluded to get online by getting tablets through funding applications and grants given to us by grant providers. And we're able to deliver and facilitate that work to try and get people online who couldn't. However, this is just showing that we were aware of the issues from an early stage, and with the whole of the VCS, we were able to be part of a great response. And we focused on older people, obviously, and we tried to ensure that they had the essentials they needed and to try to keep them as active and connected as possible. However, we couldn't get to everybody because of the fact that they don't have access, or they don't have the confidence or ability to do these things. And so there is still there are these people that we were able to support who need to be part of this kind of campaign moving forward, and there are those that of greater need, the harder to reach or seldom to reach, to try and get them on board with this campaign ahead and the year ahead. So I think what we've done is, obviously we've shown through the study how bad the situation has been on older people, and what we've done locally as a result of that to try and get people into a better place. And we need to build on that as part of this campaign to try to help people live longer, better. So I think that's that. I've probably gone over time there, Will, so sorry.
No, absolutely perfect. We've got a couple of minutes still before the break, so that's yeah, spot on. And thank you very much. That's really useful. It's nice to hear both the national and the local statistics, and I know talking to, well, I don't need to preach to anyone in the room the importance of knowing that local insight statistics for everyone's work as they progress through this line of what we're trying to achieve. So that's really fantastic, and we will circulate the slides and the recording of this to everyone that's attended today. So all of those facts and figures that Mark has presented on can be used by everyone in attendance. So I don't think we've had any specific questions for you, Mark, but there have been a couple of general, or there's another question that's just popped in. Oh, there's one. Sorry, Mark, are you going to let participants know about how Age UK have been supporting the enhanced wraparound service and getting people home from hospital to start their recovery and well-being?
Yeah, good point, Joel. So part of the Hospital and Community Navigation Service, which is a partnership of different charities or voluntary sector organisations, they, during this period, have been, like I say, they're absolutely instrumental in supporting people. I don't think they've had a day off. They may have had Christmas day off, I think. But basically, they as part of this, they not only delivered the support during the kind of first part of last year, but they've been instrumental in helping the hospitals with timely hospital discharge, helping people get out of hospital and back home so they can be more independent and recover in that setting, and allowing the flow of patient discharge and helping the hospitals manage the demand, basically. And as part of that, they actually increased the level of support with the offer. So they increased, they're 7 days a week anyway, but they increased their hours, they increased their wraparound support, and this was down to working with, obviously, the commissioners, Herts Valley CCG, HCC, Eastern North Hertfordshire CCG, the people that are funding this service ultimately. And it was a kind of a joint effort to ensure that there was an enhanced level of support to the people that need it. So yeah, absolutely, yeah, that was just probably one major piece of work that I failed to mention there. But thank you, Michelle.
Brilliant. And yeah, just picking up on that, we've been speaking to Mark quite a bit recently, and just learning all the fantastic work that's being done locally has been a real eye-opener. So anyone on the call that hasn't been on the Age UK Hertfordshire website lately, I do press you to do that, because there's some really great stuff on there in terms of what's going on across the county. Brilliant. Well, that's brought us up to our break. Thank you very much, Mark. We're going to break for 10 minutes now. Make sure you get some exercise in, everyone, whilst you can, and we will meet back and at 11:25 promptly. Okay, thank you very much. Okay, everyone. I at 11:25, so hopefully everyone's back, and we can get things going again. So our next speaker comes from the University of Hertfordshire. Really happy to have Professor Elizabeth Pike with us, and she's going to present a bit around some of the work that they've been doing.
Great, thanks, Will, and thanks to all of the speakers from before the break. Some fantastic insights, and I'll do my best to pick up on those as I go through these case studies. Just to start by saying that I am presenting this on behalf of a team of researchers at the university. They've been introducing themselves in the chat, and encourage them to continue to do so for you to be able to connect with them. So what I'd like to do is to present two case studies of work that we've got ongoing at the moment. The first of which is the contribution of physical activity to social connectivity in older adults living with dementia. And the second one, excuse me, I just had a coughing fit. The second one is a programme that's been delivered by Watford Football Club Community Sports and Education Trust, the Golden Memories programme. Just before I get into those though, I'd like to just recognise that these are studies that are building from some previous studies that have been completed, the DEMCOM study and a study that we did working with colleagues in Japan. So I'll just briefly explain those first of all. So in terms of the previous projects, the DEMCOM study was a national evaluation of dementia-friendly communities in England, led by my colleague, Professor Claire Goodman at the university. The DEMCOM study didn't have physical activity as an explicit focus, but some of the findings that came out of that study indicated the importance of engagement in physical activity for some of the participants in these dementia-friendly communities. And in particular, distinguish between activities that are located within mainstream services and organisations, which can have the potential to bridge the experience of living with dementia with everyday life, and that this prevents some kind of continuity and helps to normalise living with dementia. Those activities that are separated and standalone are still safe and still valued for people affected by dementia, but seem to have less impact on the wider community and may be harder to sustain. And this was really important learning for us when we picked up our project, which we've got the hashtag DEMCOM active, where we actually focus specifically on physical activity. And I'll come to that in a minute. And then the second project that we've learned from is some work that we did, it finished last year with colleagues in Japan. As far as we know, England and Japan were the first two countries to have dementia-friendly communities in policy. And so we really wanted to work with and learn from our colleagues in Japan. And they have, first of all, what they call the Dementia Friendly Japan Initiative. And they've produced this book, I've got a copy here which you can access, and it is published in English, which is about offering positive practical advice for living well with dementia. And I've put the link on the slides. And then the second project, which is linked to it, is the Run Tomo or Run Tomorrow programme, which is a long distance relay for people living with dementia. And what they're doing with this one is specifically using physical activity to try to create a community where people living with dementia can live safely and comfortably. And the link that's on the screen is to a film. I haven't got time to show that now, but it has got English subtitles. And it's a really nice film to show, again, how physical activity can be used to create these safe and positive communities. So again, we learned from working with our colleagues in Japan last year, and that provided the basis for the two current projects that are still ongoing at the moment. So the first one, as I said, this really develops from the DEMCOM project with the hashtag DEMCOM active. And this is the contribution of physical activity to social connectivity and well-being in older adults living with dementia, and we're looking to examine the ways that physical activity can improve the quality of life of people living with dementia, particularly well-being, loneliness, and building connections to some of the issues that we've heard from the speakers before the break. This is ongoing at the moment. The data collection is being led by our postdoctoral researcher, Becky Hadley, who has put her details in the chat. So if you're interested, please do reach out to Becky. And what we're doing is an online survey of 50 dementia-friendly communities across England. We've got case studies of 3 dementia-friendly communities, 2 in Hertfordshire, in Stevenage and Watford, and also 1 in Sheffield. We're working really closely with experts by experience from our patient and public involvement groups, which are in Stevenage at the university, also Voice at Newcastle University, Parkinson's UK, and DEEP. And the main objectives of this is we want to create a resource for people living with dementia and their carers so that they can find dementia-friendly physical activities offered in the local area. So some of the stories that we've heard so far today and some of the details that have been put into the chat, we're really keen to connect with people so that we join this up in the way that people have been describing. We want to produce more guidelines for how to make physical activity programs accessible for all people living with dementia. And in doing this, we are mindful of different cultural groups and people at different stages of dementia, including young onset dementia. So this isn't only about older people. And we will be producing a report on the benefits of physical activity for people living with dementia, including the effect of the pandemic. And we're planning to run a series of dissemination events. We'd hope to do those in person, but of course they may now be online. We're very early in finding out about this because the data collection is ongoing at the moment, but the preliminary findings that we have so far, first of all, a very broad definition of what we mean by physical activity, and following on from that, that it's really that terming, the framing of the term is really important to encourage engagement. Again, as we've heard from some other speakers this morning. So if we tell people to be active, to do sports, it might put them off. But if we say we're going around hobbycraft, then they might walk for ages. Also, that we might need something or someone to motivate physical activity. So Fitbits or a friend. Physical activity noted as having the mental health benefits, as we've heard earlier. Also really key are activities where a family supporter can attend, but also maybe have a break. So doing something together, but separately. And I'll pick up on that with our other case study, and issues about transport and financial issues that we've heard from Mark and other speakers so far today. In terms of the impact of the pandemic, again, we heard this from Mark just before the break, that people living with dementia may need support to help them gain confidence in going out again after lockdown. Some of the carers have noted that their partners have experienced a loss of mobility during lockdown. However, online groups have had benefits for some, and obviously we hope that that learning will continue going forward. But the image on the screen is of a dance class where you can see that people who are in a couple were able to continue dancing socially distanced with their partners, and other people could dance on their own, but as part of a group. And then the second programme that we're involved in at the moment that's ongoing is with Watford's Football Club Community Sports and Education Trust. The data for this one is being collected by a doctoral researcher, Danny Buckley. I'll invite Danny to also introduce himself in the chat. And this is Watford are offering a range of reminiscence and physical activity sessions for people living with dementia or memory loss and for their carers. And this programme is a combination of reminiscence therapy using memorabilia that's been provided by Watford Museum. There's a range of speakers, including former Watford players, and also it involves physical activity. The plan was for weekly sessions over a 12-week period with a continuation programme planned, and it's based in the sensory room at the football club, which you can see in the image, which has a great view of the stadium itself. The first block was completed, but the second block was terminated after a couple of weeks due to the pandemic, but the club did manage to continue to provide alternative activities during the last few months. So some of the benefits of the programme, in terms of the actual physical activity they offered, what we found from the data that's been provided is people did talk about the fact that not only did they enjoy the physical activity during the Golden Memory sessions, but they also started taking part in activities outside of the sessions and at home. And some of them also talked about the fact that things were remembered after the sessions that maybe surprised their carers. Another benefit was the benefit of social interaction. So we have a number of quotes about it's the thing that brings my dad real joy, first thing that they've engaged with in years. And that this means that not only is the participants' life enriched, but they also talked about the benefits and the value for the families themselves. A third benefit is the use of reminiscence and the memorabilia that was provided by the museum. And some of the carers talked about this actually bringing people out of their shells, giving them something to talk about that then enables that social interaction, again, not just in the sessions, but beyond the sessions. And they felt that it was because of the discussions and the dates and so on that had been discussed in the sessions, that this had somehow triggered some memories that enabled them to have something to talk about outside. And then the final benefit is about a sense of anticipation, that it seemed to be that between sessions, people had enjoyed the session so much that they knew that they would be going to something regularly each week. And so they came out of the stadium with a smile on their face, but also would anticipate the session coming up the following week and would be very keen to get back there as well. What happened during COVID was, of course, the in-person sessions at the stadium couldn't happen. So the football club replaced this by golden memories at home, which included memory boxes and doorstep visits. People identified a real absence as a result of the pandemic, which of course also reinforced the value of the programme. So people described feeling that the pressure had been put back on them and the loss of support that they'd had during the sessions. And in particular, this doing something together but separately, that some of the carers would go to the session, but they would then go into a separate room and have time when their loved ones were being looked after, but they could have a break. And they also talked about people trying to find something to do because they'd enjoyed going to the club and the Golden Memories programme so much that they couldn't understand why that had been taken away from them. And so the real loss of the programme, despite the great work that the football club did in keeping some activities going. So where we've got to at the moment, and as I say, both of these are live projects where we're still collecting data, is that we do think that dementia-friendly communities do support people affected by dementia to live well. This can include addressing the stigma and the social exclusion associated with dementia, and creates opportunities for individuals to be active citizens and access services and support that they need in the way that Mark described was problematic for some people and other people have said in the chat. We picked up on this work that came out of the original DEMCOM study, that the provision of physical activity can enable people to continue to be active members of their community by getting people living with dementia out to join existing facilities and activities with support like the Golden Memories programme, but also the value of supporting people with dementia to meet and do activity together. So to bring people in for activities in a way that of course was essential during the pandemic, and what learning there's been from that. It seems to be that physical activity combined with social interaction and reminiscence has some benefits and may create a sense of anticipation between sessions. And crucially, and Mark talked about this in a lot more detail, people living with dementia may need support to help them to gain confidence and mobility in going out again after lockdown. And so this is why Muir's programme is absolutely timely in terms of what we do going forwards. So in terms of our future planning, we've been working really closely with Alzheimer's Society, who've been fabulously supportive. And I know that Steve was on the call before the break. So if Steve McFadden is still on the call, maybe he could put his details into the chat as well. they've signed a new 2-year partnership with Sport England, which is centred around extensive insight and evidence review to build and test solutions over the next couple of years. And we plan to continue to work very closely with Steve and his team. So the first phase of this is to build insight and evidence about the challenges faced by people affected by dementia, as well as analysing the benefits to their health. That will lead into phase 2, which is about innovation and learning. So running innovation projects that then become an accelerator project to generate solutions to some of the issues that they've identified from the research and the insight, that they will be impactful and scalable. And then future plans from this, the learning from this activity, will inform outside society activity, including supporting policy work. So as I say, we'll be continuing to work with Alzheimer's Society, and Steve and his team have been incredibly helpful with our projects, and I'm sure that people will want to connect with Steve and Alzheimer's Society going forward, for those of you working in this area. So that's where we are at the moment. This is the team. I'll put my contact details into the chat after this session. And just to acknowledge that this research that we've been doing has been supported and funded by the ESRC, the NIHR ARC as well. So I'm very grateful to them for their support. And thanks, Will, for giving me the opportunity to present today.
No, thank you, Elizabeth. That's really fantastic stuff, and really nice to learn about what another organisation is doing, and finding out in such a in a cause that's close to a lot of people's hearts that are in the room. I can see the chat's exploding in terms of all the different bits and pieces that people are suggesting and asking questions around. And there are a couple of questions in the Q&A. Angela has asked if the FA is involved in, presumably, I think, the Golden Memories project. She said she's mindful of early dementia and head injuries through sport, such as rugby and football, etc.
Yes, so the Golden Memories programme is actually funded by the Premier League. Of course, that was when Watford were in the Premier League, and of course they're hoping to go back into the Premier League next season, but the funding is secured. And yeah, we've had conversations with them, particularly as Angela's put into the chat, that the very high profile of concussions from head injuries and the possibility of the links with early dementia. So we are looking at that as a separate project and working closely with Watford Football Club specifically, but also with the Premier League and the FA as well.
Fantastic. And a couple of questions that are linked, one in the Q&A and one from the chat. But in the Q&A, Caroline has asked, does the dementia research include anything around arts and crafts sessions? In Watford, in partnership with Cathathic, we offer a community cafe offering arts and crafts to people with young onset dementia and their partners and carers. And I know someone else in the chat has mentioned, has asked around any research linked with dementia and singing groups, because there's lots of singing groups around Hertfordshire. If not yourself, do you know of anyone else that might be?
Yeah, thanks for the questions and suggestions. The simple answer is yes, we are doing that. So the sessions that run at the football club do involve music, because music is a fantastic trigger for memory. So playing songs from eras that might be familiar to people and singing. They actually brought in a school choir at Christmas, the Christmas when we could have choirs in person. And also, as part of the project that we've got ongoing at the moment, there is a similar project has the same funding as us, that is actually looking specifically at arts and crafts. There's one project in Sheffield and one project in Newcastle, and so we're in contact with them as well to learn from their work. But yeah, absolutely mindful that physical activity can be taken in its broadest sense, and that physical activity might be doing arts and crafts, it might be singing and being active in that way, and it's really about what's meaningful and will engage people to have that social connectivity as well as doing the physical activity.
Absolutely. And I think from our point of view at HSP, what we've seen really valuable throughout lockdown, especially, not necessarily from a research point of view, but where we've got groups that are singing focused and experiencing really good benefits from that, that's left a door open to try and introduce some physical activity as well, which has been by far our most successful approach to introducing some of these support sessions to people living with dementia and other long-term health conditions. So really encourage any further collaborations throughout the network of people that are with us today and wider, because the more people that we can get involved, the stronger the support will be. Thank you very much, Elizabeth. That's been really insightful. And again, for everyone in attendance, we'll circulate the video and the slides with the contact details. So if you want to find anything more about what Elizabeth and her team are up to, you can get in touch directly. So for our last guest presentation, everything that we've had today so far has been very really insightful. Lots of kind of research and statistics based and insight. What we wanted to do was finish on a bit more of a case study of a local celebration of some really good practice. So I'm delighted to welcome Catherine and Jade from the Hertfordshire Independent Living Service to talk about their active ageing programme.
Hi everybody, it's just about still morning, so good morning, and thank you so much for having us at today's event. We're really super proud of the service that we provide, and we're delighted to be able to share a little bit more information about it with you today. So just a brief introduction. My name's Catherine. I'm Director of Services at Hertfordshire Independent Living Service, or HILS for short, and Jade is our Health and Wellbeing Services Lead. So at HILS, we provide a programme which we've called Active Ageing, in line with the Support England fund that has kindly supported it for the last couple of years. And hopefully today we can give you a bit of a case study that demonstrates that it really is never too late to get active. So just a very brief context about us, in case you're not familiar with us. We are a charitable social enterprise. We started off initially just as a Meals on Wheels service, which we still do, and we're now the biggest not-for-profit Meals on Wheels service in the country, which we're very proud of. And we cover the whole of Hertfordshire 365 days a year. So over the last 8 or so years, we've been developing a much broader range of services. So we started with Meals on Wheels, and we added in services around nutrition and food, and then we moved on to dementia, healthy ageing, physical activity, and a whole range of other things. All of our services are aimed at supporting clients who are mostly elderly and disabled. And we're really proud to provide a wide range of high quality services that people need and enjoy. And they're aimed at providing that little bit of extra support to help people to maintain their independence. So today, obviously, we've heard a huge amount about the importance of physical activity in maintaining the mobility, strength, balance, confidence, and positive mental health that's required to stay well and independent into later life. We really focus on clients who are sort of unable to leave their home to attend groups or classes in the community, and we support people one-to-one at home with our activities. So I'm going to just hand straight over to Jade to tell you a little bit more about our programme. Jade is our Health and Wellbeing Services Lead and has been running the programme for the last couple of years, so she's far better placed to tell you about it than I am. So I'll hand you over to Jade.
Thank you. So Active Ageing is a 3-year programme, and we're really trying to support our clients to increase their activity levels and improve their confidence with undertaking physical activity. So Sport England have provided us with funding and support, and we're working really closely with Hertfordshire County Council as well, who are supporting us with evaluating and analysing the data that we collect from our clients. The programme itself is 12 weeks long, and the only eligibility criteria is that clients must be over the age of 55. Our average client age at HILS is actually 87, and I had a quick check this morning, and we've actually had 4 clients who were 101 years old that took part in the Active Ageing programme so far. So we really are working with the older old, and as our presentation said, proving that it's not too late to get active. So we triage our clients into one of two categories. So for our more frail clients, we provide 12 weeks of chair-based exercises within their homes. And then for our slightly more able clients, we provide the Otago program, so exercises to support with improving their strength and balance. And we have PSI instructors as part of the team as well. So delivering the FAME exercise program as well. We have a really simple referral process. Our referral forms are available on our website, but we receive referrals from a wide range of sources. We accept self-referrals, referrals from GPs, physios, really wide range. So yeah. Once we receive a referral, because of the nature of our client group, often they're living with multiple health conditions, so we always want to check that they are physically fit to take part. So we make contact with their GP if necessary, just to make sure it is safe to continue with the programme. And one of the things that is really, really important about this programme is that we have a really thorough evaluation and assessment process. So we do this when we first meet the client, their first visit, and things that have come up today around falls and frailty. This enables us to identify, how at risk the client is of those, and then we can support them accordingly. Because it's a 12-week intervention, 12 weeks of support, an hour a week at a time, but we're really kind of keen to keep contact with the client to support them and encourage them to continue after those 12 weeks. So we repeat our evaluation at the end of the programme, 12 weeks. We complete it again at 6 months, and then we also check in at 12 months just to see how they're getting on as well. Is there anything else we can do to encourage them to keep up with practicing their exercises? We also support our clients with setting goals and helping them to achieve their aims. The great thing about working with someone, just you and them as an instructor or client, is you can completely tailor it. This lady on the right, in fact, her aims were around walking unaided outside, which you can see her doing with a huge smile on her face. And this was towards the end of her programme. She actually managed about 3 kilometres outside without her walking stick. So huge achievement. But again, for some of the frailer clients, it may be more around goals that involve activities of daily living, such as getting dressed or getting in and out of their chair. It's so vital that we signpost our clients to other services as well, because often they may need support with other things. And we want to, again, ensure that we don't just have an impact for the 12 weeks that we're there with them. They can remain independent in practicing their exercises long term. So there's so many great things happening over Hertfordshire, so many organisations that are now delivering virtual exercise sessions, lots of online resources. So we're kind of trying to give our clients that really good toolkit full of all of these brilliant resources so that they can remain active. Now, because of coronavirus, we had to redesign our service a little bit. So we developed what we call our hybrid pathway, where we deliver the majority of the exercise sessions via video call. We provide our clients with the technology and all of the equipment that they need for this. And we've developed a really accessible way of kind of managing the equipment so it's user-friendly. Many of our clients would never have used the internet or a computer or never used a tablet, so that was really vital for us. So we actually download Skype onto the devices, which have an auto answer feature, and that means that the instructor can call the clients as and when we're ready to start the session, get their consent, and then we can start the video call from our end. They don't have to touch a single thing. And we found that really successful so far. It's a really gentle introduction to technology, trying to close that gap. And we've had about 62 clients now that have received sessions via video call as well. So it's going really well. And yeah, really happy with how it's going so far. Now, for all of our clients, that might not be appropriate. So we do still offer the in-person sessions as well. So, you know, for example, if we've got clients living with later stages of dementia or a hearing or visual impairment, and it's just not going to work via video call, then the main thing is that we can do the exercises safely. So we would obviously provide the in-person sessions still. So again, it's the 12 weeks, but all at home with the continued support. Now, that's kind of, I'm trying to keep it as brief as possible, roughly what we do as part of the Active Ageing programme. So we've been running through about 3 years now, so I'm going to hand you back over to Catherine, who's going to talk a little bit about the impact that we've had from some of the data that we've collected so far.
Great, thank you. So just firstly to say that all of the impact stats that I'm going to talk you through now were all collected from our sort of pre-COVID model where everybody was receiving in-person support. We are going to do the same kind of analysis of the impact of the programme that we've been running over the last year during the pandemic to see how the outcomes compare between the clients who are receiving interventions via video call versus the ones who are receiving them in person. So as soon as we have that, we'll obviously want to share that more broadly. But I just wanted to tell you a little bit about the sort of success of the programme and the impact that we're incredibly proud of. It's really important for us to obviously measure the success of our programme, as well as you know, having case studies and feedback from clients about their sort of level of enjoyment of it. But we also use some you know, academically used tools to make sure that we are generating the kind of impact that we want to for clients, and that it's having a really positive impact on their both physical and mental health. So we use a number of tools and measures. I'm going to just give you a few of the highlights, just bearing in mind that we could talk about this all day, but we don't have that much time. So just very briefly, the kind of impact that we're finding that we're having is that we are helping people to increase their activity levels, their mobility is improving, we're reducing frailty and improving their balance, which has a huge knock-on benefit for their lives. And I think I'm preaching to the choir with the audience today. Everyone knows the importance of physical activity and maintaining that really positive sort of future for older people and keeping them independent and living well. So I'll just run you through a couple of the key ones. So a key issue for people in our client group is falls, and this has only been exacerbated by the pandemic. As we've seen from the information that Mark shared earlier, people leaving their homes, very little real lack of confidence and overall lack of activity. That kind of deconditioning is only going to contribute to, you know, increased fear here. And so we use the falls efficacy scale to measure clients' concern about falling. So on these graphs, the green line shows the average change in score for the overall cohort of clients, and the thin grey lines show each individual client's score change. So you can see there's, you know, quite a bit of variation, but on average there's a really, really clear difference, and clients are experiencing much less fear of falling after working with our team for just 12 weeks, which isn't really that, you know, long a period of time in the grand scheme of things, but we're really proud of that substantial decrease in fear. So another tool that we use to measure physical improvements is the Berg Balance Scale. So this measures a person's ability to safely balance whilst undertaking tasks which are, you know, really important to daily life and independence. So, for example, transitioning from sitting to standing. And with Muir Gray here, I feel like I should be standing during this presentation, but yeah, I will stand up afterwards, I promise. So on this graph, you can see the orange average line is going up, which shows that most clients are seeing a noticeable improvement in their balance. And we know that evidence suggests that Berg balance scores tend to decline each year for people over the age of 70, which really links with what Muir was saying at the beginning of the session today, that kind of, you know, decline year on year. So to be able to not only stop that decline, but help people improve, we are particularly proud that we've managed to reverse that decline for our clients. So one of the main aims of the programme, and indeed the Sport England funding for the programme and others, is to increase people's activity levels. So we measure that using the Short Active Lives tool, and one of the earlier presenters referred to those groups of, you know, inactive, fairly active and active. Now, for our client group, who, as Jade said, are mostly in their 80s, 90s, and a few in their hundreds, the sort of physical activity sometimes feels like a really big leap. We're not expecting people to suddenly start running marathons or going out cycling or anything like that every day. But we are seeing vast improvements in the level of minutes of activity that people are doing. So although we're not seeing people getting to that super active level because of the types of activities that are counted towards activity level, when we look at the minutes of activity people are doing, on average, that increased by 157%, which is absolutely huge. And you can see how low the baseline was, particularly for that frail group. Only 23 minutes of activity across the whole week. Getting that up to 70 will produce some really life-changing positive impacts for clients. So very pleased with that. And then, as others have mentioned, there's a really clear link between physical well-being and mental well-being. So we measure two things. We use the ONS well-being survey, which measures happiness, life satisfaction, how people feeling that their activities are worthwhile, and feelings of anxiety. So here again, we saw improvements across all groups. And we also noticed something very interesting, that the mental well-being scores that were measured at the beginning of the programme for people were very strongly linked to their physical ability scores at the beginning of the programme as well. So that really just underlines the importance of physical mobility in mental well-being. We also use the Campaign to End Loneliness tool to measure loneliness, because that is another really key issue amongst our client group, which of course has been exacerbated by COVID, with people being indoors for the majority of the last year, and particularly for those who are physically less able to get out of their homes to sort of connect with other people. So we can see from this graph, using the Campaign to End Loneliness tool, that there is a reduction in feelings of loneliness after taking part in our programme. And this is particularly the case for our frail clients, who saw a really substantial improvement. And this is likely due to their increased level of physical mobility, actually allowing them to increase their social connectivity and get out and about, probably for the first time in a long time for a lot of our clients. So the last thing I just wanted to share with you is about the objectives. So Jade mentioned that we work with people over 12 weeks, and we set objectives with them, and we set those for 4, 8 and 12 weeks, and the instructors do those with the clients, and it's based on what they personally want to achieve. So Jade shared the example of the client who wanted to be able to walk unaided outdoors, which is a fantastic goal. Some other examples were things like a client wanting to be able to just walk to the end of their garden, be able to get out of a chair independently, being able to put on their own socks and shoes. So these are the kind of aims that, if they are achieved, can really support life satisfaction, happiness and independence, and even reduce reliance on other sort of formal care services as well. So you can see from this graph that the vast majority of clients achieve or exceed the goals that they have set for themselves at 4, 8 and 12 weeks. And we found that that's a really fantastic way of encouraging and motivating people to continue by setting realistic and achievable goals that can keep them motivated during the programme and beyond. So overall, we're really, really proud of the significant positive impact that we've had on our clients' physical and mental well-being. And I think our programme has really demonstrated the benefits of exercise to help older adults to stay happy, healthy and independent at home for as long as possible, which is what we're all about at Hills. So I just wanted to pass you back to Jade to round off by just kind of bringing those stats to life a little bit. It's great to see the graphs and hear the numbers, helped hundreds of clients, but I think hearing and seeing some of our clients actually taking part in the programme will help kind of give you a sense of what we're all about. So I'll pass back to Jade just for a couple of case studies.
Yeah, brilliant. So I will just introduce you to Michael and give you a little bit of background about how he came to take part in the Active Ageing programme. So Michael is 91 years of age, and he was referred to us by a physiotherapist after having a couple of falls and reporting problems with his balance. Now, Michael is living alone, and he also lives with dementia. He wanted his aims that he kind of set himself were around increasing his stamina, increasing his strength, and being able to walk further. Now, you can see that he's on his on the tablet here because he did take part in our hybrid pathway, which he really got to grips with well. He also made full use of the resources that we were sending out to our clients during lockdown, and found a new passion for colouring, so much so that we had to source some extra felt tip pens for him because he got through the first lot. Now, by the end of the 12 weeks, Michael did report that his confidence had improved greatly around the home, and he felt generally more steady on his feet. An actual quote here from Michael. He said, "These exercises are keeping me alive. My mobility makes my life worth living," which I think, really profound words, and just show again the, physical and emotional impact that the exercises can have for individuals' quality of life. Michael, as I said, he lives alone, and he only actually has one family member who lives about 4 hours drive away. Our instructor who worked with Michael was able to utilise the tablet to get them to reconnect. And the sister-in-law, his family member, really enjoyed this so much so that she then went on to purchase Michael his own device, so our instructor could set it up for him so he could continue having those video calls and staying connected after the 12 weeks. A real great success story there from our hybrid pathway. And then next up, we have June. Now, June is 86 years old, and she actually referred herself to the programme. So June had lots of things that she wanted to work on. Some of them were improving her balance, improving her posture, and she wanted to kind of feel more confident walking outside again. Lockdown was really difficult for June because she used to go out shopping, she used to buy her own groceries, she used to walk with her friend by the river, but because she had to use to link arms with her friends, she stopped doing that because of social distancing. So she really wanted to kind of get confident enough to be able to go out for a walk again with her friend, and just feel more confident in general. Now, Tanya, our instructor who worked with June, was really impressed because she was so dedicated, and she really kind of just got to a point where the exercises were just part of her routine. They were, habit, and she would just wake up and she would do her exercises. So really, really brilliant. Tanya, the instructor, actually referred June for our wellbeing client of the season, which is something that we do 4 times a year to celebrate our clients' successes. And I've got just a couple of clips here to show June in action, doing some quite challenging exercises that actually when she first started the programme she wasn't able to do. So she's practicing a balance here. So she's challenging herself, a little bit of wobble. We say about embracing the wobble because it means that we're testing that balance in a safe way. And then in the centre, she's doing some work around stair climbing because she wanted to, again, improve confidence using the stairs. At the beginning of the programme, she was still using her stair lift, and by the end of the programme, she was just using the chair to carry heavy things up and down the stairs, and she was using the handrail and walking up and down again. And again, trying to keep her motivated for the end of lockdown, saying the instructor's saying here, we want to improve that upper body strength to help you with pushing the trolley. And I can confirm that June is now vaccinated. She's resumed going shopping again with her family members, but again, testament to June's kind of dedication. She still walks around the shop by herself in her own basket, even though her son drives her there, because she wants to stay independent and do it herself. And she's also back walking down the river with her friend as well. So we're really proud of everything that June's achieved. So many of our clients have achieved, but that's just 2 that have, worked really hard recently. So I think I don't think we've got time for questions. I'll stop sharing and we can come back to Will.
Yeah, I just wanted to say very quickly, we're both and the whole organisation, we're super passionate about this programme and the benefits that it has. We've tried to squeeze it into the time that we had available today, but just a short sort of plug, we do have a video that we made recently where you can see video of clients doing their exercises, being interviewed, interviews with the team and stuff, and I'll drop the link to that in the chat here. So if you've got a spare 40 minutes, you can enjoy a little bit more detail about that. But we'd also just love to talk to anybody who would like to find out more about the programme. So I'll drop our email address in there as well, and if anyone wants to get in touch, we'd love to talk to you in more detail, because yeah, as I said, we're passionate about it and could talk about it all day.
Fantastic. That's so nice to hear everything and see what's going on. I mean, the chat, I said it was exploding before, it's moving too quickly for me to actually read what's kind of going on in there. There have been a couple of questions interspersed within there, but I think instead of addressing them right now, what I'll do afterwards, well, as you've said, people can get in touch directly with you if they want to ask anything. But equally, I think following this, with the recording, with everything, I'm going to circulate a copy of the chat function as well, because there's so much good information and questions and links and everything that people are sharing that it's a bit too valuable not to. So you might be able to pick up a couple of questions out of there following this as well. Thank you very much. Again, really, really nice, and it's really nice to see the actual examples and it being used in real life, as well as the insight that it's delivering and how it kind of cycles back into the programme to inform what you're doing. And it's a really, really valuable example of something that's going on locally here in Hertfordshire, to complement the Live Longer Better movement. So to finish up, I'm going to share my screen now. And we just want to talk about the next steps. So it's really important to reiterate at this point that Live Longer Better is a movement and not a project in its traditional sense. What we're trying to do today is get this agenda in front of everyone and to get everyone talking about it. And we want to create a movement that will encourage collaboration between organisations, and that's already started. Again, if you look at the chat at the moment, people are already starting to link up and get a better understanding of what's going on in the county. And as a movement, it's only going to get stronger and stronger the more that we collaborate with each other. And if this is the banner that we can do that under, then fantastic. Within the movement, we're going to be offering a series of learning and upskilling opportunities, whether that's for employed staff or volunteers from around the community. We'd love to get those opportunities in front of as many people as possible. And all of that is contributing to an overall change of culture, a culture that, again, both organisations and the general public look at the ageing process in Hertfordshire in a different way, not necessarily looking to the inevitable deconditioning associated with ageing, but looking at it as more of an opportunity to get more physically active and to introduce more physical activity into our older adults' daily lives. So as a first step, I finalised the beginnings of a movement website yesterday. That is live now, so I'll circulate the link, but you can see it there on the screen, so you can have a look at that after the event. It hosts a lot of the theory and insights and learning materials that Muir presented first thing within the presentation. And it doesn't quite yet, but it will host some branding material that partners can download, so you can use the Live Longer Better logo along any site, any sort of promotional materials that you're using to help grow the movement and show that you're contributing towards the bigger movement as well. But more than that, I think what we want it to be is a platform for partners to showcase all the fantastic work that is happening already in the county. I had a really good comment from Tim Anfiligov earlier in the chat, and this is kind of completely complementing that we are so much stronger if we all work together. And one of the biggest issues at the moment is there's so much fantastic work going on, we just don't know about it. We've heard some really good examples today, and we're hoping that the website can take that a step further and allow partners to host their own information and details on the website, including links through to your own websites and contact details and all those sorts of bits and pieces to increase the collaboration across the county going forward. So I will be circulating more details to everyone that's attended today and hosting more details on the website around how you can get your details on there. Do bear with me. It's very much was published yesterday, so we're still getting our heads around kind of developing a website and everything associated to it, but we'll definitely get there. And as the movement grows, hopefully the website will too. Additionally, we'll be looking to deliver some bi-monthly masterclasses, and by that I mean every 2 months. Muir has very kindly offered to deliver the first of those for us, which will happen in a couple of months' time, and again we'll circulate details of that to everyone in attendance. And we're aiming to generate 1,000 advocates at least for the movement, which, I mean, we've got 200 people signed up for this movement alone, so if everyone became an advocate, we're 20% of the way there already. Finally, we'll be creating a mailing list to advertise all the new and ongoing opportunities. Again, that has been created from everyone that ticked yes to stay in touch during the registration process of this event. So really good start to that, and we'll look to grow that. And as and when different bits and pieces come about, we can get the information straight to everyone that wants to hear about it. And absolutely, finally, I just wanted to do a quick presentation around the Herts Sports Partnership and what we're doing to contribute towards the movement. And this is the sort of thing that we'd like to get the level of detail from all partners so that we can get an accumulative picture of the Live Longer Better in Hertfordshire movement. It's come along at a really good time for us, where we were at a point of, we knew we wanted to regrow our physical activity for health and wellbeing department, and this has given us a fantastic impetus and vehicle to do so. As a first step, we are relaunching our flagship older adult program, which is Active Together, which is will involve just shy of 1,000 strength and balance classes being delivered by Stevenage Football Club Foundation across the county, and that'll be a range of PSI, Otago and chair-based classes in all of Hertfordshire's local authorities. So keep an eye out for that, and we will circulate more details for those classes and how referrals can be made and people can be involved. We are generating an online activity finder, which we hope will be a really valuable tool for both professionals and members of the community to find out what activities are going on around them. And we're working with a technology provider at the moment to try and set that up. So it's not live yet, but again, we will keep everyone up to date with progression of that, and hopefully it won't be too long until we can start using that. We are in the early stages of generating a walking sports program, which will launch later in the year. So focusing on our younger, older adults, but of course, anyone that wants to take part will be able to do so and keep them moving. We're also working closely with Molly Fit, and I know John Molyneux did comment in the chat earlier on, sharing some of his details for a digital physical activity program for the over 65s. We've been talking with John throughout lockdown and some of his services, and he's created a fantastic offer, which we're really excited to launch soon in Hertfordshire. We're also working with Hertfordshire Sports Village on a long COVID activity rehabilitation project. I know they've already launched their offer within the Sports Village itself, and we're hoping to work with them to be able to offer some outposts for that service across the community to help people use physical activity to get over the negative effects that they've experienced physically physically and mentally from COVID and over the last year and everything we've been through. And we're also developing a comprehensive volunteer training package, and this is going to be in partnership with Muir and the Optimal Aging Programme, as well as Learning with Experts. And again, details for that will be on the website soon and distributed through the mailing list. And finally, John, the director at HSP, has agreed that we can help any organisations that are looking to write some funding bids to create some physical activity projects that could fall under the Live Longer Better movement. And we are able to underwrite some of the costs associated to get a specialist bid writer involved in that process to help, hopefully help the success of those bids and generate some more funding to come in to the county and to help everyone grow their services. So again, all those details will be circulated and we'll be getting them on the website. I will stress again that sort of in terms of the website is bare bones, I'd say, at the moment. So by all means, go and have a look, but do check back because things will be going on there and it will be growing kind of over the weeks to come. And all that really leaves me is to say a huge thank you, first of all, to all the speakers that have come today. A fantastic array of insights and examples of the types of things that are going to contribute to the movement going forward. But equally, a huge thank you to everyone that's come along as an attendee. The chat, I mentioned again, has been really, really insightful, and I think a powerful example of how everyone coming together can be really positive already. And as I mentioned, I will circulate a copy of that chat for two reasons. One, because I think it's a little bit too powerful not to. And secondly, I have noticed, and this is the first time we've run a Zoom webinar, that some people have commented some really powerful comments, but only to the panelists and not to all the panelists and attendees. So I'm wary that I think maybe as panelists, we've had a really good example of seeing what everyone's up to, but maybe not everyone in the webinar has been able to see everything. So I'll circulate that, and please do have a read through, because some of the bits and pieces that you might not have seen could be really valuable to you. All the details that I've mentioned will be circulated and put onto the website. And the only final thing is that as you leave the survey today, there will be a pop-up survey. It should only take you tops sort of 1-2 minutes to fill out, but it will help us shape the movement going forward. So I'd be really appreciative if you could do that. And that brings me to the end. So thank you very much for coming along. Email me anytime that you want any more information, so you've got some ideas that you want to talk about, and hopefully together we can create something really powerful going forwards. Thank you.